off. People can probably just add in as they come in. So basically, yeah, is everybody, if the panel are happy, we'll kick off, yeah? Great. Okay, so well, good afternoon, everyone. My name's Sarah and I'm the Chief Executive with the Children's Heartbeat Trust. Delighted that so many of you could join us this afternoon. We have over 60 signed up for the webinar, which is fantastic, and I think really highlights just how important these sorts of events are for our heart families. And I think also, given the news yesterday of the extended lockdown, it's probably quite a timely event. So before we kick off properly, I just wanted to run over some housekeeping. So what we're going to do is that our panel, Professor Nichola Rooney and Professor Frank Casey, are going to introduce themselves, give a little bit of an overview about their roles, what they've been doing around COVID-19 and how it's impacted and all of that. And then we are going to open it up for questions. So please type your questions into the Q&A box that's on your screen. And what we'll do is we'll try and get through as many as we can in the time that we have. And if we don't get through them all, then we'll try and answer any other ones offline. So just to also let everybody know that this session is being recorded and that we'll have the link up on our social media pages to share it after the event. So now I'm going to ask our panel to introduce themselves. First we can hear from Professor Nichola Rooney.
Hi everyone, so I'm Nichola Rooney and I'm Chair of the Children's Heartbeat Trust. I'm also a clinical psychologist by background and actually worked in Clark Clinic many years ago when my love for working in all things cardiology started and hasn't ended. So I'm very happy to be here today. I've done a short presentation simply because I find quite often people are a bit reluctant to ask about things psychological and mental health. So that will trigger some discussion hopefully, but I'll let Frank introduce himself before I start that.
Hi, good afternoon, everybody. I'm Professor Frank Casey. I'm a pediatric cardiologist here in Clark Clinic in the Department of Pediatric Cardiology. I'm the clinical lead for this service. And so I'm delighted to have the opportunity to interact with some of our patients and families this afternoon, and hopefully we can answer some of your questions. We don't have all the answers, I'm sure, but it's good to take this opportunity. And as Sarah says, it's timely given all of the events, and it looks like we have a few more tough weeks ahead of us. So I hope it all goes well today.
Okay. Professor Rooney, are you going to share some slides?
Okay, if you're happy, I'll run through these.
Yeah.
And this is really just to jog any questions that people might have and hopefully even answer some before you have to ask it. And it'll be available afterwards as well. So sharing the screen is always interesting. Okay, so can you see that? Hopefully?
Yeah.
Okay, so I suppose the most important thing that the message I want to get across is really that we have to look after our mind and our heads and our mental and psychological health as well as our physical health. And you know, you can't have listened to the news that we're not hearing about all the tsunami of mental health problems that are coming. And I suppose I want to add some kind of context to that and say that probably isn't actually the case, that people are much more resilient than we give them credit for. So hopefully I can give some words of hope around that. And I know that most of you are ringing today because you're worried about your children in all of this. But when it comes to psychological health and well-being, it has to start with you. You know, the children watch what we do, they react to us. And if we're not in a good place, well, then the children will know that and they pick that up from us. So it's not selfish to be looking for some time for yourself and self-care. It's absolutely necessary. And there's lots of great information on the Public Health Agency site and elsewhere about the Take 5 to look after ourselves and well-being. But I think the important thing about that, it's not just that it's a good thing to do. Doing these activities actually affects our brain chemicals, which makes us feel better. So you can see from this slide that dopamine, which is what we get whenever we're kind of rewarding and feeling good, that's actually released by listening to music, by self-care activities, by even getting a job done and feeling that satisfaction. That releases dopamine in our brain, which is really good for us. Keeping our mood stable and keep the serotonin, so that stops all the mood swings that a lot of us will have been having. Doing things like deep breathing or going for a run, all of those things can help with that. Oxytocin, which is our love and contentment hormone that we usually associate with our relationships, can be playing with a dog, can even do that, holding hands, that connection. And then the endorphins, which are really important painkillers, laughter and dancing, particularly to ABBA, I find, dark chocolate, like that one as well. So I suppose it's not just that they're good things to do, there's actually a physiological basis to why we do these things. So I would encourage everyone to try and take time to take 5. Sleep is really underestimated, and there's so much research coming out now about the importance of sleep, and we know that poor sleep can actually cause generalized anxiety disorder in children as well. So I want to put that in because a lot of you won't be getting enough sleep either. So please do try and develop some good sleep hygiene. I touched on this idea of mental health tsunami and all of these mental health disorders, and I just want to, I'm putting this up just to say that it's normal to feel stress at this time, absolutely normal. If we find ourselves worrying about things, not able to separate out issues, or minds a bit muddled, if we find that usually the difference between that and an ongoing anxiety disorder is usually it's manageable, and once we sort a problem, it goes away. But the feelings that we get with anxiety and stress are very similar. Things like our elevated heart rate, or feelings of impending doom, which most of us have at the minute in this COVID. But it's only when it becomes really persistent and interferes with your life, and you may even start to develop panic attacks, that you probably need to think of maybe doing something other than just trying to ignore it. So in relation to the children, one of the big measures coming out now is the mental health impact of children, the mental health impact of closing schools, and that's raised a lot of anxieties for parents. And I suppose one of the questions is, what makes us resilient? What makes some children able to cope and others can't? And there's always this kind of balance between nature and nurture. But the good news is that nurture has a significant role to play, and what we do can affect that. And the 3 things, suppose the 3 things I'd like you to take away today, and the basis of all my talks, rather than the most academic to a chat, the 3 things for developing resilience are control, competence, and connectedness. Those are if you just think of the 3 C's. So in relation to control, basically that comes from a theory of depression. Is all about taking away control. So they get these rats, they train them to do all these clever jobs, pressing buttons and all sorts of things, and the rats are very fat and happy. And then they change it all around, so they get an electric shock instead of milk, or they get cheese instead of water. And the chaos that's created means that whenever they put the rats into the water, they've forgotten how to swim, so the rats drown. So they've lost their innate ability because they've lost control. And that's the theory that underlines depression. So one of the things I do, have always done in my professional life with the client who walks through the door, is think of a way that I can give them control over something. And even if that's picking the date for the next meeting, that's enough. So if you can get control for yourself over anything, or your children, that's really important. And some questions have come in about returning to school, and concerns that children have, and being fearful. And I suppose the big thing is to include children in this, to talk to them about it, to listen to what they're saying, take it seriously, get them to write it down. Also their hopes. So whenever you're having, focusing on one area to try and take away, there's also hope as well as concern. Maybe get them to draw a picture of their ideal safe school, what that would look like, ways that they can make themselves feel safer in school, like hand washing. And then doing some little goals that are achievable that you can give them rewards for, so they develop this sense of control and mastery. Connectedness, we've all struggled with being connected at the minute, but one of the factor that comes out in every mental health study you do, the most important factor that wears out everything else when it comes to children, is the availability of one stable, caring relationship. So you are that person, and that is the wonderful thing that the children in our families have, the access to that. So it's really just about making ourselves available, but obviously also spending time, being connected through play, and finding ways for them to connect with their friends. So the other C for competence, that's really just about knowing what to do. So most of us can do it if we know what to do. So teaching children how to manage their emotions, and there's lots of websites and techniques for that. And I've just put up some examples of this, but I've got resources at the end that you can pull on, but really important to teach them how to breathe deeply if they're anxious, and it's okay to cry, and asking for help and solving problems. Routine is particularly important. Routine makes children feel safe because they feel the world is okay when the routine is still there. And then there's other clever ways of helping children understand what distancing is about, and fun ways of helping them find ways of being safe. So some of the resources here that I've just put up, there's a great NI stress controller, or providing free stress classes. So the types of things, they're normally quite a cost associated with them. They're free. They're running through February and March. So if you go onto the website, you'll be able to attend these courses for nothing. And there's also a COVID wellbeing NI website, which is rammed full of information. And there's also some self-help things that you can do. And there's great information on children. There's a lovely video that was developed by Psychology in the Belfast Trust. And I've got the YouTube link to that, which is a cartoon that explains coronavirus to children. And then there's the Young Minds website that's got lots of stuff for kind of older children and teenagers that they'd be able to access themselves. So that's me finished. It's a quick flash around coping and well-being and getting your children back to school. And I'm happy to take any questions later. Thank you.
Thank you very much, Nichola. That was great.
Right.
Thank you.
Stop sharing the screen is going to be the next one. Okay.
Great, thank you. Okay, Professor Casey, would you like to go ahead and introduce yourself?
So I am Frank Casey, and I suppose what Sarah had asked us to do at the start is just to give a little bit of a summary of our experience over the past year, in a year that I suppose none of us had foreseen. I've been a doctor for 35 years now, and I never in my wildest dreams thought that we would live through a year like we have in the past year. Going back to the beginning of last year, or around March of last year, when the pandemic sort of started to emerge in the first phase, I think all of us as doctors who worked with children were obviously very concerned at that time, particularly for our patients with congenital heart disease, as to what the effects would be and how vulnerable they would be. And I suppose we have had a steep learning curve over the past year, and what we have learned has been largely reassuring for us, in that it has been manifest all over the world that children with congenital heart disease thankfully have not been shown to be at significantly increased risk of becoming very ill with COVID-19 infection. That's not to say children won't pick up the virus or have the virus, but for reasons that are not particularly clear to us yet, they do seem to be by and large resistant to becoming very ill with it. And I know as parents that I hope is some reassurance for you. It won't take away the worry. I know time and time, every day of every week for the past year, I've talked to parents who have had very valid concerns about their child. But what I can say to you is that our experience here in pediatric cardiology is that thankfully we have only seen a very small number of children come into hospital with COVID-19 and their heart condition and being unwell with it. In terms of how we've obviously had to remodel the service over the last year and try and function in much more difficult circumstances in terms of trying to prevent infection spreading within the hospital between patients. And very much so between staff, because largely this has been an adult disease, and we've had some members of staff who've had COVID-19, thankfully, who've all come through that very well. But every day we're taking precautions, abiding by all of the things that you're familiar with outside of the hospital as well. I know that many of you have been concerned about the access to treatment for your children, and we have been doing our very best to keep up with with doing the things that we would normally do. Obviously, we can't keep things completely normal. We worked very hard through all of this past 12 months to try and keep the children who need urgent and emergency procedures getting those, and we have been able to achieve that. Thankfully, one of the things that has helped with that is that, in fact, children haven't been coming down with other infections as well, and that has freed up some more intensive care beds. So surgery has remained very much on track. It does take a lot more work around the time of surgery in terms of COVID screening, and I'm aware of it being a much more traumatic time for parents in terms of access just to see their child, but we've managed to get the things that really need to be done. Congenital heart disease doesn't change in a year. It continues to, children continue to be born no matter what's happening, and so our work in the ward has continued as before. Where we have had to scale back a bit is in our outpatients department, basically because of social distancing of parents and families coming to that clinic. So we've had to restrict the numbers, and some of you may have had telephone consultations or video consultations, which we've had in some cases to do as an alternative. But we again are prioritizing as best we can those that we need to see, and we have been seeing an increasing number of patients over the past few months. It will take us a while to catch up. I think even if COVID-19 cases go down rapidly, I think all of us realize that over the next few months we're still going to be dealing with this problem, but with the vaccination of the adult population predominantly, I hope that will give us more opportunity to upscale our services. At a personal level, it's been, like everyone else, it's been a trying year. Well, I guess the thing that we all find is that there's not a lot of downtime. The things that we all did to switch off are not so much available to us, but there have been many good things as well over the past year in terms of having more time with family, and so I think we will get there. The next few weeks again are going to be, I suppose, tough for all of us. But I do really believe that with the vaccination, there is light at the end of the tunnel, and so that's probably all I wanted to say at the outset. I hope that we can help you with some of the questions that you have, and I'll hand back to Sarah and let her take on from here.
That's great. Thanks so much, Professor Casey and Professor Rooney as well, for your time this afternoon. We really appreciate it. So, got some questions coming through, and we've got some questions that were sent through before the webinar as well. So I'll just start there, if that's okay. So a question has come through and has also been reflected in the questions before, sent through via email. It's something you touched on there, Prof. Casey, just around the outpatients appointments and the delays to that. I think there's a real desire to get more knowledge kind of around whenever like echo scans might start up again, because I think that's something that gives family the reassurance that everything's going in the right direction, even if there are understandable delays.
Yeah. So I suppose the short answer to that is that the outpatient echoes are ongoing. They are started. We way back at the beginning of the pandemic, we were very restricted in who we could bring realize that we have to take a balance between what may, you know, expose staff and other families to the virus with the need to see patients. So we are doing outpatient echoes. Our clinics at present, what we have to do whenever we see the list of patients due on a particular day is to go through that list and see who we really need to see in person and who perhaps on one occasion we can see by a telephone call. But I suppose I would still encourage people to contact us if they do have real worries, particularly if there's any change in symptoms through either the specialist nurses or through our ward staff or the consultant secretaries. We're fielding calls every day, obviously, and in terms of this kind of question. But I suppose in pediatric services, we haven't had to switch off as many things as perhaps our adult colleagues have obviously had a much tougher time in dealing with COVID. And so we do have investigations of all kinds ongoing. It may take a bit longer to get them, but don't be concerned that there will be a very long delay beyond what there normally would be.
Okay, that's great, thank you. So then there's a few queries have come through also about the vaccine. And I suppose just around that, one of the questions was, whenever the vaccine is rolled out to children, would it be the pediatric cardiology team's advice that heart children get it?
Yeah, so the vaccine obviously is a huge issue in terms of what the future brings. Just to summarize, all of the trials so far of the vaccine were all done on adults. So there hasn't been a clinical trial of any of the vaccines in the childhood population as yet. It's just, there are a couple of trials just about to start. The AstraZeneca vaccine is going to be trialed in children, as is the Pfizer vaccine. And the results of those trials are expected to be available in the next few months. The Pfizer vaccine can be given down to the age of 16 years of age at the moment, but there's no vaccine currently licensed or tested in the childhood population. So as yet, we haven't been able to get a directive, you know, in terms of using the vaccine in children. We do expect that in time it will come, and I would expect that as they have done within the population over 16, those people who are considered to be more vulnerable would get priority. I don't have that in writing yet, but that's what we would expect, and therefore children with, you know, who have significant congenital heart disease, when the vaccine becomes available to children, I think would be in one of the priority groups.
And just as a follow on from that then, what age is a child? Because there's have query through from a parent whose child is 16, and they're just wondering if they would think that they would normally fall within the category 6 for vaccination, but how, you know, what's the likelihood of them getting it then, or is it strictly over 18s at the minute? Is that what they're looking at?
No, I think 16-year-olds will have access to the vaccine. The only vaccine that's been licensed down to 16-year-olds at the moment is the Pfizer vaccine, and that vaccine obviously is not the one that's available in GP surgeries. So people in the age group 16 to 18 who are deemed to need the vaccine will probably, I think, have to get it through the vaccination hubs that are, you know, based around the hospitals largely. But I think it will be available in that age group to those who are deemed clinically extremely vulnerable.
Great. So then go through the vaccination hubs. That's not through your GP. Is that through the hospital, or how do you...
That's through the hospital. That's the hospital. Yeah. So
they would need to make contact with the their consultancy team as opposed to their GP to get that, or would
the GP. Yeah. Sorry, Sarah. The Pfizer vaccine, because of its requirement for storage at low temperatures, isn't available in the GP surgery. So that it's purely that reason that that it has to be done in the setting.
Oh, okay. So their GP can still refer them to the vaccination centre?
Yeah, I don't know what I have to say, you know, that I don't know the detail of how a GP would do that, but if there's anyone, you know, the numbers within that category are going to be relatively small, and I think would be easily accommodated within appointments in a vaccination hub.
That's okay. Sorry, Professor Casey, I know that you don't have all the answers, so it's okay. I don't think anybody does, and a lot of it is still to be found out.
Yeah, as I said, you know, this is a learning curve. So much has been learned over the last year, and some of the fears have been unfounded. But then, of course, we've had all of the twists and turns along the way with different variants and things, and that will happen in the coming months. There will be, you know, other twists in the tail. But you know, what has been done in the past year is pretty remarkable, and I think, and unprecedented in medicine in terms of both treatment and you know, having vaccines developed in that time scale. So there is real hope that we will come through this and be able to keep people safe in the future. Great,
thank you. Okay, I've got a question for Professor Rooney here, just around teenagers and supporting teenagers through the lockdown. Just says the lockdown has been really tough for my teenager, and she's spending lots of time online. What can I do to encourage her to get out a little bit more?
Well, just because there's COVID doesn't mean that teenagers aren't very difficult sometimes to manage. So, I mean, I think the most important thing really, which I touched on before, is talking about any concerns and spending time, usually, you know, doing other things or joint activities together. Trying to meet up with, I mean, it is possible to go outside and meet up for the purpose of exercise. So even having a buddy somewhere that they can meet up with and to go for a walk or grab a cup of coffee. Online is difficult because we want to reduce the time people spend online, but at the same time, this is the only way they can connect at the minute. So I think it's just, you know, if they're online and they're connecting with people, I wouldn't probably be as worried. If they're online and doing very solitary things, I think that's what I would try and reduce slightly. But trying to find, I mean, hopefully we will be able to get out a little bit more when the weather improves. But just activities, if there's any kind of activity that they enjoyed outside, I mean, you have to weigh up risk and keeping in the legal boundaries, but also, you know, the benefits of doing other things. Having, you know, stretching things slightly to have a friend round to sit in the garden or do something, I don't think it's the end of the world if you're really concerned that they're spending too much time on their own. And the other thing is, it's very hard. Most of the difficulties that people are facing at the minute is the uncertainty, and in particular for young people in relation to their schools when they can meet up. So it's about having some way of planning something in advance to look forward to, but also finding out what aspects of this that they can control and letting them take charge of that. And, you know, finding someone that they'll talk to, even if it isn't you, making sure that, you know, they're checking in with someone, because so long as they're able to voice their concerns, that is half the battle. But there's, I mean, whenever I go out now for walks with my dog, I am seeing lots of people outside, and I am seeing groups of young people outside. And I'm actually pleased in some ways to see that. You know, if they're being safe and being distant, I still think you can do that. So I would say your best chance of getting them outside is if they can find a friend to meet up with.
Okay, that's great. Thank you very much. Okay, this is another one, a few here for Professor Casey. So there's one around the new COVID strain seems to have a bigger effect on children. Can you reassure in any way about this new strain, whether it does have any other effect?
Yeah, so the newer strain of COVID-19, there are some reports that more children do become infected with that particular strain. I guess what's most important about it, any person who gets COVID-19 is not so much that they get the virus, is how sick they get with the virus. And what the evidence that I've seen, and it is all preliminary evidence, is that although more children may actually test positive for that variant, there is no evidence to say that that variant is making them more unwell than any of the other variants. And so right across the board, you know, some of the South African, the so-called English variant are said to be more infectious, but we haven't seen it make children more unwell than previously. What some, I suppose, just to mention it, what some parents and others may be aware of, there is a rare complication of COVID-19 that can occur in children who are previously healthy with no congenital heart disease, where they get a multisystem inflammatory disorder, and we have seen a small number of children with that, thankfully all of whom have recovered, but children can become unwell with that. But it's a tiny percentage of those who get COVID who will develop that particular multisystem inflammatory complication. So the variants will emerge, and some will need to be dealt with in different ways, but right now, as I say, our experience is still that that's not something that we have to be particularly concerned about in children.
That's actually just brings me on to a question just came in about multisystem inflammatory syndrome, just asking, are cardiac children more susceptible to this?
Yeah, they're not. It's a condition that occurs in children who don't have underlying congenital heart disease. It's very similar to another condition that we have seen for many years called Kawasaki disease, where children get an inflammation essentially of the blood vessels, and the blood vessels in different parts of the body, including the coronary arteries. And it emerged, this illness emerged primarily in London at the beginning of last year. In the past 2-3 months, with the third wave of COVID-19, we have seen some previously healthy children come into hospital with it. The treatments of it are to give what we call immunoglobulin and steroids, and the children do seem to respond to that. So there will be reports in the media of this condition, but for parents of children who have congenital heart defects, they are not more prone to this illness than others.
It's good to hear. Just a question then about just if any child become extremely ill with COVID, with heart disease, like within the care of the Royal?
We haven't. I'm aware of, obviously, within the pediatric cardiology community, we talk obviously to other centres. There's experience in some centres. Without worrying anyone, the patients who have become more unwell with it have been those who are in the adult congenital heart disease group, who perhaps, as with all adults, are more prone to it. We've had children come into hospital who've tested positive for COVID-19 who have underlying congenital heart disease, but sometimes they've come in for another reason. And I suppose it's important to let parents know that every child who's admitted to this hospital at the moment is tested for COVID. So if you come in and have a broken arm, you get tested for COVID, and that's just in terms of you know, infection control reasons. And sometimes when we've done that, we find that people have swabbed positive, but they haven't had a clinical illness. And I don't want to tempt fate, but in all of the past year, we haven't had a child with congenital heart disease who's needed to be admitted to intensive care purely because they have had COVID. Children with congenital heart disease obviously sometimes have other system disorders, and the accumulation of things can make them unwell.
So there's a question around long COVID there. So I suppose if they haven't really got sick with COVID, there's not much evidence around long COVID either, or has there been any different evidence there?
I wouldn't for 1 minute say that I'm an expert on long COVID, Sarah, but I know some staff have had long COVID, but not. I think we've all got long COVID right now, but the children, no, not that I'm aware of. Just as you accurately say, when we don't see them becoming acutely unwell, we haven't seen, you know, a chronic illness with them up to this point. These things perhaps will become more clear again in the coming months, but we have a year's experience now and we haven't seen it.
Okay, that's great, Frank. But another question here for Nichola as well. Professor Rooney, just a question came through around like kind of the signs of anxiety and what you should be looking out for in your child if you're worried that they are becoming anxious.
I mean, I think first of all, I'd say it'd be very unusual for people not to be anxious at this time. So it's good that they're anxious because it means they have their wits about them. Usually it depends on the age of the child, how it presents itself. So usually in younger children, what you see is a kind of a regression, so that they lose some of their milestones. They might start to bedwet again if they've been dry. They might get very clingy, and you'll find ways where they may present with some kind of psychosomatic symptoms like sore tummies, unexplained sore tummies, and just looking for displaying behavior that makes you think they're a bit needy. So watching out for those are a kind of a normal sign of stress. Usually children's behavior shows their anxieties rather than them articulating it by saying that they're scared. So if you keep an eye on those things, and that's why routine is really important, so that we're inclined to think, oh dear, love them, and then spoil them. But I think if you spoil them but keep the routine, is very important. Doing things like, I mean, you'll find out much more, as you know, you're the experts of your child. There's nothing that I can tell you that you won't know about your own child. So just watch out for those signs, spend time with them. And it's quite often you'll get much more through doing drawings and paintings and activities than asking them outright. As they get older, you know, well, I would normally say academic work might drop off, but at the minute I don't know that anyone's academic work's keeping up. But so school difficulties with their work, grumpiness, cutting themselves off slightly, nightmares, you know, not wanting to go to bed on their own, staying up to keep company, things like that. And then usually as they get older, they're more likely to close down than anything. And that's why it's important that they keep connections, because there comes a time whenever they don't want to tell their parents and they're more likely to tell friends or a trusted other one. So that's why I think access to these online stress classes and things and psychological first aid are really helpful. You know, it's things that we should all have been taught in school. Everyone knows if they burn their finger to run it under a tap. But if you get a panic attack, no one really knows what to do. And they're every bit as frequent, probably more frequent than burning your finger. So just understanding some of the easy techniques to manage stress is really important. So you know your child, and if you have an inkling, you're probably right. If that answers it.
Great, thank you very much. Okay, I've got lots of questions coming through. So yeah, just there's one here about a baby who's had recent open heart surgery, and just whether the parents, if they get COVID, should stay away from the baby.
Yeah, it's a really tough thing to do for a parent to stay away from the baby. I think in practice, it's not going to be possible, Sarah. Sometimes we have this situation in the hospital as well, and what we've done is to try and still allow the parent to have contact with the child. The child can be monitored and swabbed if necessary, but the risk, thankfully, should still be very low to that child.
Okay, thank you. There's a few questions all around the theme of traveling for surgery, and just about the safeness of traveling, and also how many parents can travel with the child. Yeah,
so this is one of the hardest things we've had to deal with in the last number of months, particularly in intensive care units. Quite reasonably, the there has to be a restriction in the number of people coming in and out of intensive care units. The more people who are there, then the more likely there is to be someone who is perhaps even asymptomatic with COVID. So it's very tough, but what the current restriction with parents being with their child in hospital is usually that it is one parent, and where, for instance, when we have children traveling to either Dublin or Birmingham, quite often two parents will travel to that centre, but only one person can be with the child. And what's really tough is that more recently, particularly in the third phase of COVID, it has to be the same parent. Also, parents can't swap over. And that's pretty traumatic and exhausting for the parent who is with the child, often in a side room, and there's no way that we can underestimate how tough that is. It is a restriction that's there to try and protect everyone. The travel, I suppose the travel, there are small risks with the travel, but everyone. I guess that, you know, through the travel process has to take their own precautions. We wish it could be different at the moment. It's what I would say is that for important discussions, say the pre-op discussion with the surgeon, then both parents are allowed to be present for that. Or if, you know, if a child was not doing well post-operatively, then exceptions can be made where they need to be to allow both parents to support each other. And so everyone as clinical staff finds that a really tough thing right now.
Okay, thank you. And there's a few ones here. Should we be giving CHD children vitamin D supplements?
Hadn't thought about that. Vitamin D I guess I'm not sure what the reasoning behind the question is. It just off the top of my head, I guess it's because they haven't had as much exposure to being outside as well in terms of actually getting vitamin D. Most children in their diet will get adequate vitamin D, and the most natural way to boost that is to allow them, if they can, to be outside as much as possible.
Great, thank you. There's a question about how has COVID impacted on fetal cardiology appointments?
Yeah, so in fetal cardiology, we have clinics every week where we see patients, mums who from, say, their routine anomaly scan, or perhaps there's a concern on that scan that the fetal heart may be abnormal. For all of those cases, the appointments have remained unchanged. Normally in our fetal cardiology clinics, we would see perhaps a mum who has previously had a child with congenital heart disease in the next pregnancy for reassurance that everything was okay, even though the recurrence risk is very low. For those kind of appointments, we have had to restrict those, and that's basically because the directive has obviously come right from the Department of Health to have people only within the hospitals who absolutely need to be there. So if some mums and dads, who obviously many people who are listening in today will have had children with previous with heart problems and are now expecting another baby, it may be difficult for us to see you during the pregnancy, and I wish it could be different, but that is the reality at the moment. But if there is a concern from anyone else in obstetrics who scanned the baby's heart that it might not be normal, you will be seen.
Thank you. Just to read a comment here about just saying thanks for taking part in this to our panel, and about how reassuring it is, and that it's so much appreciated by this particular family and many other heart families. So thank you. Okay, there's a few questions just around carers. Just as parents of CHD children, would they be likely to receive the vaccine as carers? I think this is quite a complicated issue about what is a carer.
Yeah, so that is a real grey area. I suppose I wouldn't like to give a very definite answer to that question, but I suppose my honest assumption at the moment is that purely as a carer of a child with congenital heart disease, that would not make you eligible for the vaccine.
And there was another question that came in just around that as well, about getting the jabs. And just to update on the news yesterday, that was that all carers over 50 can now book into the vaccination centres. So I would say that if parents do think they're carers, to register with their GPs as a carer, because that will then allow you to maybe get the jab whenever it moves down again for carers through the age groups. So if people aren't registered as carers, then it would be our recommendation to go speak to your GP and get on their books as a carer, and that would hopefully give access to the jab as it works down through the age groups. Okay, so then, oh, are there any plans for an All-Ireland conference this year?
That's a bit of an easier question. So the conference is usually in November, so November is quite a way away yet, obviously, but we have a contingency plan. First of all, there will be a conference. The question is what form it will take. Many of the cardiology conferences or all of them over the past year have either been cancelled or in virtual form. So if it's not possible to have a conference in November with people attending, physically attending, we will have a virtual conference. And there are pros and cons with that. One, I suppose I've participated in a couple of them now virtually, and one thing that it does do is it gives people access to the conference who might not be able to travel otherwise. It means that you know, personal discussion and interaction are not possible, but there will be a conference of some kind, and I think it's very important that we do so, because there have been a lot of very important developments within the network over the past year as well. And I would say that we as a clinical group have been really so grateful that we did have that in place in the last year, when the logistics of travel and dealing with everything else in the COVID-19 situation, to have access to surgery on the island. It didn't make our job easy, but it made it a bit easier.
That's good. Then there's just a few more questions left. And there's one around transitioning and just how that's changed over COVID, the transition process for children, from pediatrics to adults.
So the transition clinics were paused for a number of months, beginning last March. The transition clinics are up and running again. We have an ever-increasing number, obviously, going across to the adult. We probably transition now close to 100 young people every year across to that adult congenital heart disease clinic. Because of the restrictions with the numbers of outpatients, particularly on the adult side, it does mean that the actual next appointment at the adult congenital clinic may not happen as soon as it would normally have been scheduled. What we've been trying to do is still to make a provision that even after the patient has begun the process of transition, that they would still get an appointment in the pediatric service until the next one becomes available in the adult side. So it is a part of the service that has been a bit more difficult, but the transitioning is still going on. Okay,
thank you. So then this is a question that I think both of you would have an input into. So it's just around a young 12-year-old who just had kidney operation, due back to school after Easter, and parents are concerned about his return to school, and what's the panel's advice on his return to school, and what precautionary measures should they as parents take? So the child also had open heart surgery as a baby.
Okay. Well, I maybe take the first part of it. We have, for someone who's had open heart surgery as a baby, I suppose it's very difficult to give specific advice just without knowing the detail of the diagnosis, but making the assumption that the child has had successful surgery as a baby and is being followed by us, it would be our advice, given our experience over the past year, that it would be very important for that child to go back to school whenever they're recovered from the effects of the kidney surgery. Obviously the return to school for that age group is going to be a bit phased and erratic over the next while. But we have, with only some exceptions, advised that the best environment for the children with congenital heart disease, as I say, except for very specific conditions, and we will have contacted you if we don't think your child should go to school. The balance the review of our team, and not just our team, but of pediatric cardiology teams and experts in health across the world, is that the benefits of the interaction, social and educational, for children, if school is open to them, that they should avail of that. And I get asked this question almost every day by someone who comes, you know, as to, and we respect, you know, the concerns that some parents have. I've had some families who said, well, I don't care what you say, I'm keeping my child at home. So, and that's an individual decision. But purely on the medical evidence, that I'd say a 12-year-old going into school, they may encounter the virus and may indeed get the virus, but statistically the chances of that young person becoming unwell with it are very, very small. And so we make the judgment on that basis that it is for the overall benefit of that young person to be in school with their friends, with their teachers, and trying to have as much normality as possible.
Thank you.
It's well seen Frank has spent so long with psychologists. Because,
I think I need a psychologist.
Absolutely right. And that is the advice that, you know, there's no 100% proof safe answer to most of these things. It is about managing and weighing up the risks and benefits, and school is definitely the best place for children. In relation to, you know, I noticed that you're talking about fairly recent surgery, and that's really your call about how well recovered he is. And I think children having responsibility for their kind of self-care in relation to their physical needs is really important. And one of the good things that's come out of COVID, if we can say good things have come out, that people are much more aware of hygiene and ways of keeping themselves safe. We've had a huge drop in flu. We've had a huge drop in kind of gastric presentations amongst kids as well, because we've been distancing and doing it right. So, you know, from that point of view, with proper safety measures, and you just need to check, I suppose, at the school that you're content the school is the proper safety measures. But in terms of the child, I think it'll certainly aid the recovery, and certainly aid their psychological development as well as their educational.
Great, thank you very much. Okay, that's great. That's all the questions we've had come through. So there's just comments from lots of parents just to say thanks so much for your time and about how reassuring it's been. There's a ladies attendant from Dublin and is really grateful for the time, and great to keep up links between families. So I think now we're coming up to 3 o'clock, so we will end our webinar now. I would just also like to add my thanks to Professor Frank Casey and Professor Nichola Rooney for giving up your time on a Friday afternoon to answer these questions and give us the benefit of your advice and your expertise. I think everyone will agree it's been really, really informative and helpful, and we really appreciate your time. Thanks everybody for attending as well. We'll have a link up to the recording in the next few days, and if there is anything else, we'll try to respond to anything else we get offline. But thank you very much, everybody, and have a lovely weekend.
Thank you, Sarah.
Thanks for asking us.
Thanks,
Cindy. All the best. Bye now.
Bye. Bye. Hi. I was just calling to see how you think that went.